Welcome to today's episode of Aesthetics and Wellness by Dr. Yusra. On today's podcast, we have Dr. Kate speaking about lifestyle medicine, giving you specific advice about what you can do every day in your life to improve your health span and your lifespan. We cover the 6 pillars of lifestyle medicine, and we empower you to take ownership of your health. Join us, and I hope you enjoy. Hi, everyone. Welcome today to our podcast, Aesthetics and Wellness by Dr. Yusra. Today, I am joined by Dr. Kate, one of our amazing clinicians at the London Clinic and the Liverpool Clinic. Dr. Kate, you are a superstar. You have huge amounts of experience in surgery, in aesthetics, in general health. You're also a qualified yoga teacher. Tell me a little bit about you.
Hello, thank you so much for having me on. So thank you for that lovely introduction. I'm Dr. Kate. My background is, as you said, I'm a doctor, originally did my training in Sheffield and started out doing my surgical training. That was my initial kind of career goal in life, and then fell into the world of aesthetics, as commonly happens. And then from there, I've really expanded into becoming really interested in more of taking a holistic approach and a whole holistic approach to my patients, both in aesthetics and in the medical field in general. So that's me.
So all of our clinicians at the clinic have been handpicked and are people that I trust with my own face. And case in hand, you have done my skin peel essentially. So my face is not falling off because I've got a contagious disease. I've had a skin peel, which is why it looks like this. And I'm midway through that skin peel. So you do a whole host of different treatments at the clinic, from skin peels to injectables. But one of our main driving forces and the ethos of the clinic, the mission to what we want to provide our patients, is radiance on the outside, wellness on the inside. And I'm really passionate about curating a team of experts who marry on with that ethos, who will look after patients in the same way that we do. And that really means taking a holistic approach to health and well-being. And I know that you really understand that ethos, and you look after your patients inside out. And it's not just what can we do to the face and how much filler can we put into the face and what injectables can we do, but actually how can we empower our patients' health? Because health on the inside reflects very much on the outside. And you have a huge range of both personal and professional experience with the health and wellness holistically, which we're going to talk about today. And you've got a passion for lifestyle medicine. And this is something that we are really passionate about. And we don't really just see our patients as one in, one out, filling them like an eclair. But how can we teach them about lifestyle medicine, what lifestyle tweakments they can make that will help them look radiant on the outside and be healthy on the inside? So talk to me about lifestyle medicine. What exactly is that?
Absolutely. I just want to touch before we go into that. I really think that's where aesthetics is going in general. And I know we both echo that vision of taking a more holistic approach to patients. To answer your question, we can talk a little bit about lifestyle medicine. And there are actually 6 pillars of lifestyle medicine. We can touch on those in more detail, but they are nutrition, sleep, stress management, physical exercise, social connection, and avoiding harmful substances. And by focusing on each one of those pillars and trying to improve in each one of those and bringing that into the aesthetics that we're doing in clinic, I think we can really offer our patients more of a full holistic approach to their care, rather than just, like you said, focusing on filling people or just looking at what we see in front of us.
Agree. So no filling like an eclair. So in terms of, see, for me, lifestyle medicine is something I'm really passionate about. The way that I kind of fell into lifestyle medicine is actually through my own illness. When I was 19 years old, I think I've told you the story before, I got an autoimmune condition, which happened because of stress. I was a second-year dental student, and anyone that knows dentistry, it's second year is like the killer. So that was one of the things that was going on at the time. The other thing was my father was a surgeon, and he had to leave the UK to go to Iraq to help in the Iraq War. And at the time, literally every bomb that was going off, we didn't know if he was going to survive. My uncle was kidnapped and tortured for 3 days. It was a really horrific time. And at the same time, I met the man that I am married to today. But my dad was completely against it. And he was, he said, you're not getting married to that guy. He completely didn't want to entertain it. And it was a really, really stressful period. And after that, I developed an autoimmune condition called polyarthritis. And I have no doubt that stress was a huge instigator in that. And we know now how the impact of stress on even immunity. So with polyarthritis, the way that it was treated at the time was with prednisolone, which is a long-term steroid to reduce inflammation. I ended up taking that for 9 years. And steroids, as you know, can reduce your bone density. So that ended up causing osteoporosis in my spine, which I found out about after having my first child at the age of 28. So now by 28, I had arthritis, I had osteoporosis, and I was told by the doctors, you've got to now start medication to stop bone turnover, bisphosphonates, and you can't have any more children. And it was devastating. Like the worst thing you can say to anyone is you can't have children. I think that's a really difficult thing for any woman to hear. And I cried myself to sleep for months. And I thought, well, what's my trajectory? My whole world was in my hands. My background is in head and neck surgery, maxillofacial surgery. And I really did not know what my future held until I went to see this incredible doctor. My friend was working for him at the time. She said, look, just come and speak to him. And I went to see him and he gave me something that no other doctor gave me before, which is hope and time. And he taught me about lifestyle medicine, and he literally dissected every single thing that I did. And I mean, like, he dissected my food. He asked me what I cook with. He asked me if I have any tin foods in my home. He made me chuck them out. He told me that I had to start eating organic eggs and go to a farmer's market, get organic eggs, keep the eggshells, and use those eggshells as my source of calcium. So I really turned my life around through lifestyle medicine, and it saved me. And from that day till today, I haven't taken any steroids, and I completely took myself off medication, and I did have 2 more children. So I'm a huge believer in lifestyle medicine. I have seen the impacts both personally and professionally in how I support my patients in their own well-being journey. So these 6 pillars are actually really important pillars and have been scientifically researched. Functional medicine in itself is a huge emerging field, and it's so interlinked with aesthetics because your skin is your largest organ. And so what you are doing on the inside will inevitably impact what you see on the outside. So let's talk about that. Let's talk about those 6 pillars. And I'd love to start off with nutrition. And I know that this is a big one for you because you've recently done the Zoe, which is a test to see how your body responds to specific types of food. So talk to me about nutrition.
Sure. So, I'm very passionate about nutrition. Yeah. And for anyone who doesn't know what the Zoe test is, I recently It's a combination of a gut test, so a gut microbiome test, a blood sugar test over 2 weeks. It measures your blood sugar levels in response to the foods that you eat, and also your blood fat levels after eating certain controls that they get everyone to eat. So you get a measure of this across the board.
So blood fat, not blood sugar.
Blood fat, blood sugar, and gut microbiome. Those are the 3 things they test. And then you get your results, and it gives you a individual score based on how you respond to foods that you log over the course of a few weeks. Now, I think the most interesting part of that is everyone's response to these foods is individual, and actually your gut microbiome impacts how you respond to food. And this is a really emerging area of science that we're only just starting to discover more about. But I think coming back to focusing on nutrition and educating our patients on that is where preventative medicine or just prevention of disease in general is really important, because if you can improve your diet and prevent developing a disease, that's going to be much better than trying to fix it with a drug when it's already there, if that makes sense.
Yeah, I think food I know you don't like the statement, but I always say you are what you eat, and what you put on the inside, what you are literally ingesting, you're putting into your body, that's your fuel. That's what will power your body and what you'll be able to give out. So nutrition is huge, and nutrition can heal. Food is medicine. And we know this because of so many scientific data, research that has shown that specific supplements for specific food types, adaptogens, eating 7 fruits and veg a day has been actually clinically proven that if you have 30 different fruits and veg over a week, you can reduce your cellular aging. And we now know that aging on the outside actually starts from how your cells are aging, and that you can impact cells on the inside, because fillers are all very well and good to make you look younger, but that's what they are designed to do. They will mask aging. You're still aging. Your cells are still aging. Your skin is still degrading. So fillers don't actually stop that. They just put a little plaster on it and they make you look good. But when we're talking about lifestyle medicine, we're talking about actually biohacking and changing how your cells are responding. And you can do that based on what you're putting into your body. So when your patients are asking you, and I know there's no blanket advice, right? It's very bespoke. We will bring our patients in. We will talk about their specific lifestyle, their specific medical profile, if they have any other issues going on, pathologies, diseases that we need to take into consideration. But generally speaking, what is the advice that you give to people for when it comes to nutrition?
So trying to increase the diversity of what you're already eating and keeping it simple. So maybe if you add one extra vegetable into your meal in the evening and aim to increase an extra piece of fruit in the day, keeping it little steps like that at the start and slowly building up over time, focusing on the diversity, and then also trying to reduce the number of ultra processed foods that you're eating. And I think we should probably define what an ultra-processed food is. So essentially, a piece of fruit or vegetable is not processed at all. And then any food which comes in packaging, a can, that is processed. That doesn't necessarily mean it's harmful. It's when it's been ultra-processed, refined, and it has other added chemicals added into it. That's what we're finding scientifically in the data is suggesting is harmful to our bodies.
All these E numbers and refined foods and carbohydrates.
Exactly. So trying to reduce the number of foods like that you take in, and you can just start by looking at the ingredients when you pick up a packaging, and then trying to increase the diversity of fresh fruit and vegetables, plant-based foods, can be really helpful.
Okay, that's great. So when you're talking about plant-based foods, are you telling people to go vegetarian or not?
So the jury is out on whether you should go vegetarian or not. My personal opinion is I choose to eat meat, and it's a great source of protein. However, I primarily only eat chicken and some fish. Red meat, less so, because it's been shown to be slightly more inflammatory and tends to be more processed, like bacon is a highly ultra-processed food. But I think that's something that's individual, and you can't give
blanket advice. I think also the thing with foods, chicken as well, meats, that some of them are processed as well and fed hormones. So that's another thing. So I do eat meat. I do eat red meat. But what we do know is that grass-fed, free-range meats are better than not. So if you be very selective, even down to your butters. One of the worst things that you can have in your body is vegetable oils. They are like the root of all evil to me. And people don't realize, but they're almost everywhere, even in their butters. So a lot of spreadable butter, for example, is rapeseed oil, a huge amount of rapeseed oil. So start to pick up your foods and look at what you're actually ingesting. Things like butters, if you actually get grass-fed butter from cow's milk, it is a lot healthier than rapeseed oil that is spreadable. That people don't realize that. So vegetable oils we need to cut out as much as possible. And then there's a huge drive, and there has been a huge drive for people to move away from things like cow's milk, which is fine, and that's a personal choice. But they need to understand what that actually means and what the alternatives offer. Like, for example, almond milk or oat milk. I'm not a big fan of oat milk, and I always tell my patients, look, be really wary of it, because oats are sugars. They're wheat, they're grain. And that means that when you are having oat milk, which is essentially oat juice, that is full of glucose, that's sugar water. And what really kills is the insulin spikes. It's that grazing and insulin spikes. And the reason why, and we now know this, is that as we're aging, we are more likely to develop something called insulin resistance. And so our bodies become more resistant to insulin. And over the last decade, there has been a movement away from people having 2-3 set defined meals a day to grazing and eating smaller but more frequent meals. And actually, the research is really clear that that is not a healthy practice, because what you are doing is, and this starts from the oral microbiome down to the gut, every single time you are putting a sugar into your mouth, the bacteria in your mouth, and there's billions of bacteria in your mouth is full of bacteria. some good, some bad, and that's what we call the microbiome. The bad bacteria, so to speak, start to feed on that sugar, and the environment in the mouth becomes acidic. And that acidic environment lasts for 1 hour after you eat, 45 minutes to 1 hour, and that starts to eat away at your teeth. Now, your teeth can handle 3 acid attacks a day or 3 hours worth of acid a day. But if you're constantly grazing, you're constantly in an acidic environment, and not only are you eating away your teeth, but you're swallowing all of this acid, and that's impacting your gut microbiome. And we now know that your gut microbiome is hugely related to your skin health and your mental health. So, and we also know that when you have things like poor oral health and bacteria, the poor bacteria, the bad bacteria called P. gingivalis. P. gingivalis can increase your risk of developing dementia and Alzheimer's disease 6-fold. So if you have gum disease, you are 6 times more likely to develop dementia or Alzheimer's disease. And if you have Alzheimer's disease and you have untreated gum disease, it will progress to 6 times more likely. And this comes down to, again, nutrition. This is something that is completely preventable. Gum disease completely preventable through good oral hygiene. But even your foods, even the frequency of eating is very important, and reducing your sugars. So I say to all of my patients, particularly women who are moving into that perimenopausal phase, be really mindful of what you're ingesting, but also how often you're ingesting it. Because every time you are eating, your body releases insulin, a hormone that helps to manage that sugar, as you know. And the more often that insulin is released, if it's released more than 3 or 4 times a day, more than 5 times a day, you're really starting to create an increased susceptibility for your body to become resistant to insulin. And insulin resistant predisposes to the development of diabetes. So a condition of endocrine disorder where you're no longer able to regulate your sugar. And that results in increase in enzyme called matrix metalloproteinases, which break up your collagen, impair wound healing, increase the likelihood of you developing cardiovascular disease. So it's all very, very much connected. So, nutrition for me is what you eat, but also how often you eat it. And I also always advise my patients to intermittent fast where they can. What's your thoughts on intermittent fasting?
Yeah, I think there's a lot of really exciting emerging evidence coming out at the moment about the benefits of intermittent fasting. And most people have probably heard of where you fast 1 or 2 days a week. I think that became quite popular in the last 5 to 10 years. And it's been shown to be really beneficial for weight loss specifically. It was a dieting protocol. But actually what we're finding now through the scientific data is that fasting for longer than 12, up to 14, 16, sometimes even 18 or 24 hours is really beneficial for reducing inflammation within the body. Also reducing inflammation within the brain, allowing the body to go into a state of healing and repair. There's been evidence to show that it's really beneficial for women who have menopausal symptoms, for example. It's a huge benefits across the board. Although, as you mentioned, I would say it's something that you need to do or work up to. I wouldn't suggest maybe immediately going and doing a 24-hour fast if you're not used to fasting. Perhaps you just try and ensure that your eating pattern within each day is you're leaving a 10 to 12 hour window overnight. So when you finish dinner at say 8 p.m, trying to ensure that you wait until 8 a.m. the next day to eat breakfast. That's a 12-hour window. Yeah. So starting there, and then you can gradually build up to bigger fasts when you feel ready and able to.
Yeah, so you're kind of tiptoeing your way there. So the idea is that you're reducing your eating window and increasing the window of you not eating. And of course, when you're sleeping, you're fasting. And that brings us on to lifestyle medicine treatment number 2, which is sleep. So to summarize nutrition, we want our patients to have better diversity. So we want them to reduce any ultra-processed foods, any refined sugars, cut out where possible any refined oils, vegetable oils. Another thing that I think a lot of people don't know is that I want to touch on with regards to nutrition is milk, actually. And I hear this a lot with patients who have got acne, and they say, I've completely cut out dairy. Now, dairy may be a cause for inflammation in some patients, but not all. And what we do now know is that the full fat milk is actually full of protein and fats, which are beneficial to you. And there's full of vitamins as well. But semi-skim milk is devoid of those nutritional elements and the fats, and sometimes have got sugar added to them. And we now know that semi-skim milk increased the risk of patients developing acne. So there is a causal link between semi-skim milk, not full-fat milk, but semi-skim milk and acne. So when it comes to treating a specific pathology, what I like to do is really go through what my patients are eating, right down to what type of milk are you consuming, because that's one of the most fundamental things that people are usually having and consuming on a daily basis. And so it's really important to know where that source is, and where possible, go organic. Avoid tinned or processed foods. Organic foods that have less chemical loading, less hormones, will make a huge impact, because again, we are ingesting those hormones. So moving on to sleep, talk to me about sleep medicine. Is sleep necessary? How much sleep should we be getting? And what are you saying to your patients about when they should get to bed?
So I think anyone close to me will know I am a big fan of sleep. I like to get about 9 hours sleep personally. But I think that is different for each person.
Especially if you've got young kids.
Absolutely.
Yeah.
I've not
years
quite
of
reached
sleep
that
torture.
stage yet.
Yeah.
So the science would say that everyone needs about 7 to 9 hours sleep a night for to be optimum health. So most people will probably fall somewhere within that range, and you might be more 9 hours like me, or you may be more towards the 7. And we all know we should get more sleep. It's good for us. It allows our body to heal. It allows for repair of tissues. It's important for good mental health, focus, all of these things. And I feel that we're kind of repeating something that everyone probably already knows by saying that, although it is important to touch on it. I think there's other things we can mention here that perhaps people are less aware of. Something I came across recently, which I thought was really interesting, was the importance of getting early morning sunlight exposure and the benefit that has not only on your mood throughout the day and your cognitive function, but also how much it impacts and improves your sleep the following night.
Yeah.
And the reason for this is when you're exposed to early morning light upon waking. So when I say early morning light, I mean sunlight within the first hour of it of day.
So that is specifically, if we get really specific, is that 45 minutes to 60 minutes post dawn, sunrise.
Exactly. It will vary if it's cloudy. If it's a bright day, a clear sky, then you need less to get the benefit compared to on a cloudy day. But about 15 to 30 minutes of early morning sunlight is very important for cognitive function, mood, and also getting a good sleep the following night.
Amazing.
And the reason that happens is because when you're exposed to morning light early in the morning, you get a release of cortisol, which is actually a stress hormone, and people commonly know it as being a bad hormone, but it's actually very important for healthy functioning, and you want it to rise as early as possible in the morning. And that sets up your circadian rhythm, and it contributes to setting up your circadian rhythm in a way that you then sleep better the following night. So I think if there was one thing I would say to patients that they could take away is try and get outside for 15 minutes in the morning as early as possible.
Yeah.
And that will have a big impact on your sleep as well as your overall health.
It's such a big thing. I agree with you. Well, we now know that our bodies absorb light, right? And actually, even when your eyes are closed and the daylight breaks through your curtains, your body starts to absorb that light, and it starts to reduce a hormone called melatonin. And melatonin is your sleep hormone. And then it stimulates the release of cortisol. So one of the first things that I like to do in the morning is open up my curtains and get light. And my cells, I know that literally, even if your eyes are closed, your cells are absorbing light. And that's, again, there's so much emerging data about this. But we've just invested in a phenomenal device in the clinic called Emerald Laser, which you know of, which is a low-level laser light therapy, the first green laser light therapy in the world that can actually help with reduction in body circumference, improving hormonal regulation. It creates transitory pores in the fat cell, and that means that it allows fat to literally leave the fat cell. And what we now know is that fat is actually very important for us. Fat is there to keep us warm, but also for hormonal regulation. And in our society, about 60 to 70% of the society are thought to be overweight or obese. And we know that obesity increases your risk of getting cardiovascular disease, 13 different types of cancer, type 2 diabetes, and is one of the worst things for you. And often patients who have very high inflammation in their body are not sleeping well. So it's this negative feedback cycle. So fat reduction or improvement of BMI, your body mass circumference, is very important for hormonal regulation and reduction in preventable disease like cancer and so on. So with the emerald laser, what we know now is that our body absorbs light. Specifically, it absorbs actually red light and green light. But green light and red light has been studied for years. And now we know that our bodies absorb more green light than red light, every single cell in our body. And it impacts right down to a cellular level by increasing the mitochondria, which are little battery operators within our cells that give us energy. And that increases what we call ATP production, which is the fuel for the cell to work. At the same time, it reduces inflammation, and inflammation is a precursor for all disease. So we've got the emerald laser in our clinic, which we use as a wellness treatment. When I'm feeling unwell, like now, I get into my emerald laser, and we know that helps to improve healing because it improves and optimizes cellular function. And so light is a huge, huge thing. And so many of us are not getting enough exposure to light. So even if it's in the middle of the day, I say to my patients, look, open your curtains, get out, go for a walk. If you can't go for a walk, just literally step outside and get direct sunlight. That direct sunlight will help to reset your circadian rhythm. And your sleep is so important for detoxification. It's literally a means of getting rid of cellular breakdown, toxicity within our cells that can build up within our cells and within our brain. So there's a specific sleep cycle that is very important for that called REM, rapid eye movement. And I try to tell my patients, I'm guilty because I don't always do this myself, but I try to be asleep between 10 p.m. and 2 a.m. every day. That is your optimal sleep, REM sleep cycle. If you're asleep between 10 p.m. and 2 a.m., you're more likely to be getting into a deeper sleep. You're getting into your REM, your rapid eye movement, and you are detoxifying your cells. And there has also been evidence to show that if you manage to get your REM sleep, you will lose weight. So patients who are struggling with weight loss in particular, or are obese, we always say to them, you need to get more sleep. And you're less likely to be waking up in the morning looking for that sugar rush because you're exhausted. So you wake up in the morning, you're much fresher. And if you can get to sleep earlier, then you'll get awake earlier. And if you can get awake, usually just after sunrise, and you get that special infrared radiation that comes from that first 45 minutes of daylight, you're resetting your circadian rhythm, which has huge medicinal health benefits. So it's such a vital thing. And I think we kind of have abused our bodies, particularly as medical practitioners, as healthcare practitioners, as shift workers. It's really hard for shift workers as well to get enough sleep. But where possible, you really need to be getting your rapid eye movement sleep in and get exposure to daylight. If you're struggling to sleep at night, get exposure to daylight, or get under an LED light, or get under a true laser diode like the emerald laser, because that has huge medicinal properties, healthcare properties. We now know that the emerald laser has 22 FDA approvals, not just for body circumference loss, not just for reduction in inflammation, but even is now being investigated for reduction in ADHD, which is a behavioral disorder. So sleep is huge, and I agree with you entirely. Exposure to light helps to actually normalize your sleep cycles. Is there anything else that you would advise patients for sleep?
I'm just adding to what you say. I really think I'm a firm believer for any chronic disease or psychological issue, or anyone even that comes to the aesthetic clinic just looking for a treatment. I think keeping things simple and focusing on the basic things like good nutrition, improving sleep, is going to have a massive benefit and impact to our patients.
Yeah.
So yeah, just adding that.
Okay, so we've talked about nutrition, we've talked about sleep. Let's talk about stress, because stress is a big one. We've talked about cortisol, the hormone cortisol. Cortisol is that hormone that gets released every time we're stressed. People think it's the evil and the bad guy in our bodies. And I think it is and it isn't. It is actually very necessary for response to acute situations, like if we're in danger or if there's a lion in front of us, we need adrenaline, we need cortisol, we need to leg it, right? We need that hormone to be pumping around our bodies to take action, fight or flight mode. But what does chronic stress do to us? What happens when we've got cortisol running through our bodies all the time because of life, or not switching off, or not knowing how to switch off, or exposing ourselves to taking on too much and not knowing when to say no? What does that actually do to your body?
So just like you said, I think it's really important to differentiate between a acute stress, which is beneficial, like you said, from running away from a lion or something, and that's a initial rise in cortisol and adrenaline, which then tends to fall pretty quickly afterwards. But it's when those cortisol levels and adrenaline levels remain high over a prolonged period of time, or if you're exposed to multiple stressful moments or over a period of days to weeks, that's when it can become harmful to us. And we know that can have a very negative impact, both psychologically and or physically. It causes actual breakdown within tissues. And stress has a personal relation to me, in the sense that, as you know, I went off with burnout about a year and a half ago. So I have my own experience of that. And I look back on that time where I was living in a state of high stress, high cortisol for a long period of time, working very long hours, sitting exams, doing night shifts. And I became mentally unwell, but also physically. I tore a ligament in my hip through no specific injury. It just occurred. And I really believe that was related to the fact I was in such a high state of stress. My body was unable to heal. But going back to what you mentioned, what can we do to reduce that? It's really important to think about the things that we can do in our daily life to reduce stress, because stress isn't going away. We can't always change the environment that we're in, but we can focus on what we can do individually to deal with that and have more resilience to it. Something I came across recently, which I think is quite interesting, is just an actual very simple breathing technique, which Andrew Huberman studied recently. They looked at a few different breathing techniques and the effect it had on cortisol level and how it reduced stress levels within the body. And it's called the physiological sigh. We can link a video to it in the footnotes if people are interested in doing this breath technique. You can do it anywhere. It takes a few seconds.
Talk me through it. Let's do this breath technique.
I can talk you through it. So you take a long, deep inhale through the nose until you feel like you've taken a full inhale, and then you take a short, sharp second inhale. And then slowly exhale through your mouth. So we'll do it together. Inhale. And that's it. There are many, many different breathwork techniques out there, but that one has been shown to be scientifically the most beneficial at reducing your stress levels in real time, immediately.
Yeah.
And we can practice it anywhere. You can do it driving. You can do it lying down in bed. You can do it with people and they don't even know that you're practicing it.
Yeah.
And then thinking about things that we do in our daily life to reduce stress on a more long-term level. So we'll come on to this shortly, but exercise is so important for reducing stress levels. Just physical movement actually helps close the loop of that stress cycle within your body. And then things individually you find relaxing. So that might be spending time with friends, perhaps having a bath. They're basic lifestyle things that you get enjoyment from and you feel relaxed in. Trying to incorporate some of that, even if it's just 5 minutes into your day where possible, can have a big impact on your stress levels.
Yeah, I think it's huge. I mean, like I told you, my autoimmune condition certainly, I think, was instigated by stress. And every time I am under stress, I start to feel it starting to flare up a little bit. And I become really conscious about taking things off my plate. And I'm that typical, I'm in my late 30s. I've got 3 children. I run 2 clinics. I lead a huge team. I'm a mentor. I'm a speaker. There's a lot going on, wonderful things in my life, but a lot of stressors. We have at least 300 patients walking through our doors every month. There's a lot of responsibility. And so I have learned about the power of no. And I talk to my patients and I really counsel them about this power, because it is a power. Being a yes woman and saying yes, 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 yes to everything, sometimes overloading your plate will naturally result in stress. And then no time, no me time, no downtime. And so you almost become addicted to this high, constant, elevated cortisol that you get this restlessness and you don't know how to stop. And then when Christmas comes around or you finally forced to stop, you become unwell. And the reason why is because cortisol is a stress hormone, but also it's an immune suppressant. I took steroids, exogenous steroids, prednisolone, to reduce inflammation in my body when I had the arthritis. And so this immune suppressant actually keeps you going because you're in this acute or chronic stress mode. And then as soon as you take that away, you get unwell. But actually that's because all of this unwell cycle and ill health was happening underneath that was being masked. And that's the problem with stress. That's the problem with heightened cortisol that is not managed without decompressing. And if you don't sleep enough, then your stress is going to get higher. If you're eating unhealthy foods, your stress is going to get more. If you're not exercising, your stress is going to get more. And if you don't take things off your plate, so learning how to say no and being really mindful about your capacity, about your bandwidth, about what you allow on your plate is a huge thing. And then things like meditation or starting your day right. I think that physiological side, that breath work is so important. I gave birth to I have 3 children. I tried to birth all 3 naturally. The last one did not want to come out. He was too big. So he had to be literally cut out with an emergency C-section. But the first 2 children, I was purely through breath work. I did hypnobirthing. I gave birth in a pool. And it was entirely harnessing the power of my mind, of my body. And I'm a big believer in that breath work. And so I say to my patients, when I'm about to do a treatment, we're about to do an injectable, and I can see they're stressed, they're kind of breathing a little bit more fast, they're tensing. I say to them, okay, nice deep breath, breathe in for 5 and breathe out for 6. And we know that elongated breath out helps to reduce and manage their stress cycle. So there's so much power in breath, but also affirmations. So, when I'm having a really hard time, I'll go in front of the mirror and I'll do a warrior pose. And I'll literally say to myself, I am legend. And I say to my children now, I use that language with my children. And I'll say to my children, say I am legend, say I am strong, say I am kind. The way that you talk to yourself, it's almost a manifestation, is what you will also give out. So there's so much power in that. And I think meditation is a huge one as well. And you know this, you're a yoga instructor. You went to India for 6 weeks. You recently came off, what was it, a 10-day no talking retreat?
A 10-day silent meditation course.
Just incredible. I don't think I could handle that. I could speak for England, but there's so much power in that, right? And not enough of us take that time to do that. Now, I probably couldn't do a 10-day meditation course. I think I would self-combust. My children wouldn't handle it. My husband, I'd come home to a hurricane. But taking back my time, taking back my power has been hugely important to me in also maintaining my ability to function optimally. So I'm giving the world the best of me, not just the rest of me. So stress management, because you're right, stress is not going anywhere, but stress management, carving out me time, whether that is a spa, a massage, a facial, a bath, getting out, walking. If you can't, if you're running, whatever it is for you. Actually, running is not that great for you, but we can talk about that in a minute. But getting that decompressing and letting off a little bit of steam is very important, because otherwise you burst. And burnout, like you had burnout, takes huge amounts of energy and time to recover from. And will always be a source of something you never want to go back to. We're talking about burnout, and it can really put you off. And I think doctors, high achieving, ambitious people in the workplace are particularly now are really, really struggle with and are at risk of burnout. And the sooner you see the signs of it, the sooner you take action to prevent it from happening, the better. So that brings me on to exercise. And that's another pillar of lifestyle treatments or lifestyle medicine. Talk to me about what exercise you're recommending to your patients.
So when I talk to my patients about exercise, I like to explore with them a little bit more about what they're already doing and how they move their body. I sometimes refrain from using the word exercise because I think it can be a bit triggering to some people, particularly if they are someone that isn't exercising regularly or they haven't done in years. And so I try and talk to people about just physical movement. So getting out for a walk, or perhaps there's someone that enjoys dancing in their sitting room. Whatever that is, trying to do that for a little bit each day, getting their heart rate up and making it enjoyable. You have to find something that you enjoy doing. And if that is going to the gym and lifting weights, great. But for a lot of people, that's not. And it's something else. And so I talk about that and helping them explore ideas about what they might enjoy doing more of, and then touching on the actual benefits of exercise. So I think historically we think of exercise as being a weight loss solution. But it
or going to the gym and working on a treadmill and being really bored. But
it offers so much more benefits than that. It is so important and valuable for your mental health. I've already mentioned how it helps close the stress loop within our bodies when we're in a heightened state of stress. And when I talk about that loop, what I mean is when you are in a heightened state of stress, if you exercise, it allows you to lower those levels of cortisol and get back to a state of being more still and calm. And something I know we're very passionate about within the clinic is we see a lot of patients who are going through the menopause or perimenopausal and are starting to experience symptoms that they're struggling with. And there's a lot of evidence at the moment showing that exercise is one of the best ways to deal with some of those symptoms and have the most benefit. So I try and educate my patients on those things and help them explore ways that they can bring it into their life more.
So it can be kind of dancing by yourself, dancing with a partner, going outside, running, walking, movement. The sedentary lifestyle can kill, actually. And we know that now more than ever. I say to my patients, try and get 5 minutes of being in a deoxygenated state a day. And what I mean by that is being breathless. Whether that is running up and down the stairs, which is really boring, or literally putting music on in the morning, starting your day with a dance around your bedroom, 5 minutes. Get into a state where you are for 5 minutes your heart rate is up and you need to breathe a little bit faster. That deoxygenated, breathless state helps again to detoxify the body, helps with mental health. My husband is a psychiatrist and he says to all of his depressed patients, you need to exercise. It's one of the things that we know clinically proven. It's not just about giving you a tablet or an antidepressant. That lifestyle tweakment can make a huge impact on your mental health. And again, also your physical resilience and your physical strength. And we know that as we're aging, our whole body is changing. From obviously our cells are aging, but even our muscle mass is reducing at a rate of 1% every single year from the age of 35. People think they're not aging until 50. Little do they know, you start aging at the age of 25. Your optimum is the age of 25. Men start to lose muscle mass from the age of 35 because their testosterone reduces at the age of 35. Women, same. And muscle mass is very important, not just for looking good, not just for lifting weights, not just for power, but also for bone density, also for, again, hormonal balance. If your hormones are off balance, again, that results in muscle mass decrease. And there's this negative loop. So you need your muscles because when your muscles are functioning, they're pulling on bones. And when your bones have been stimulated, they increase in their density. And we know that as we age, particularly women, and we lose estrogen and progesterone and testosterone, our bone density reduces. And then we become at increased risk of developing fractures, osteoporosis, osteopenia, and our facial volume also changes. So maintaining muscle strength is absolutely vital for also maintaining bone density. I've got osteoporosis because of my 10 years of taking prednisolone to reduce the inflammation from the arthritis. And, I found out I had osteoporosis at the age of 28. So you can imagine I had arthritis, I had osteoporosis. For me, maintaining my bone density is so important and my muscle mass. And for years, particularly after having 3 children, last thing I wanted to do was go to the gym and lift weights. So that was a real mental block for me and a barrier. So every time I bring in a treatment into clinic, it's almost like an investment for myself. Well, it is an investment for myself. And one of those treatments is, for example, M-Sculpt Neo. Now, a lot of people know M-Sculpt Neo to be a treatment that is there to reduce fat. You've heard of M-Sculpt Neo. Mm-hmm. So it's a device that utilizes and joins in 2 modalities of treatment. So it's a combination of high intensity focused electromagnetic stimulation, which means when we put it on the body, anywhere that we're treating, whether it's the arms, the abdomen, the glutes, so the bum, you are causing 100% of the muscles to contract at any one time. So in a half an hour treatment, you will get 20,000 super maximal contractions. So the muscle fully contracts, every single muscle fiber fully contracts. And that results in an increase in muscle mass and muscle number. So you get hypertrophy and hyperplasia of muscle, which is fantastic because that means you're getting more powerful, stronger. You're reducing the risk of sarcopenia, which is muscle mass reduction as we age. But also there's now new clinical evidence conducted by Professor Kotofana that has shown that the likes of Emsculpt Neo can actually improve bone density, particularly in the hips. So we're using now high intensity focused electromagnetic stimulation, not just as a treatment to give you abs or to lose fat around the abdomen, but actually to improve wellness and reduce fractures. And when we're talking about, for me, lifestyle medicine is all about increasing health span, not just lifespan, because we know we're living longer. Healthcare is better. We've got so much medicine around us. So people are now living a heck of a lot longer. But how much of that lifespan is actually healthy? So many people are developing dementia early. They're getting cancer. They're getting arthritis, osteoporosis, diabetes. There are all kinds of killers that are impacting them slowly but surely. They're killing them slowly but surely. So if we can increase health span, and if we understand that every single layer of our body needs to be looked after, not just the skin, not just what we put on our skin on the outside, but everything from our bone density to our muscle mass, and that everything is connected. If our muscle mass is good, actually, we know that increased muscle mass improves testosterone. So if you've got low testosterone, you've got low libido, get in there, get exercise, and you can improve your endogenous testosterone, which will increase your libido, which will increase your ability to lift weights, which will increase your energy, which will increase your mood. It's all related. So exercise is a huge, huge one. And I think getting breathless, at least for 5 minutes a day, can massively impact and heal the body. So that's a big one. Now, the next one I think is social connectedness. Talk to me about social connectedness, because you and I were talking about this, and we have grown up in that generation where 10 years ago we were told, hey, women, you don't need men, and Miss Independent, and you don't need anyone, don't rely on anyone, just you yourself, crack on. And people don't hang out with each other anymore. What does that do? What does isolation do to us?
I think we've all lived through the last few years with coronavirus, and I'm sure everyone has their own personal experience of seeing the impact that had, that social isolation, and how it affected most people's mental health negatively, unfortunately. And I think also in an advent and a world of being more online, social media, working from home, whilst these things offer many great benefits, they can also increase the amount of social isolation that we're all experiencing. And interestingly, I came across the other day a scientific study which showed actually quite how important social connection is for our physical and mental health. This study looked at about 7,000 people, men and women, and followed them for 9 years. And interestingly, they could look at all their different habits and categorize whether they were healthy or whether they were unhealthy habits. And they found that the people who were carrying out more unhealthy habits, if they had a good level of social connection, they were actually 3 times more likely to be alive at the end of the 9-year study than those who didn't have good social connection.
Yeah, so isolation literally kills.
Exactly. And whilst I'm not suggesting that we don't follow healthy habits, if you have a good social connection, then
makes a huge impact.
You've got a massive protective factor there.
That's right. Yeah. Getting out more, speaking to friends, speaking to family. There's huge healing that comes in social connectedness. And we're social creatures. They say it takes a village to raise a child. I don't have a village, but I do know that isolation is absolutely soul destroying sometimes. And I see this a lot in women who are perimenopausal as well, or menopausal. It's this negative cycle, and of course it's stimulated by this hormonal imbalance. And because they start to, estrogen reduces, testosterone reduces, progesterone reduces, they start to suffer from anxiety, their facial shape starts to change, they start to get dry skin, they start to notice jowls, their jawline is going. And when that happens, they start to notice they start to get anxiety, overwhelm, brain fog. They're not sleeping well. They want to kill their husbands. They're finding their children really irritable. It's this negative cycle. And in the end, what they end up doing is they end up isolating themselves. They don't want to go out. They don't want to see people. They refuse all social gatherings. And that's this negative feedback cycle. So when I'm speaking to my patients, particularly perimenopausal women, I say, force yourself. You need to go out, go meet a friend. And there's, they say problem shared is a problem halved. That is really, really important, actually. So talk to someone who can understand and speak to you and assess your problems objectively and also create a safe space where you can talk to somebody else and listen to them. And I think that's something that as women, we naturally do quite well up until we hit perimenopause, and then we really suffer and isolate ourselves. And also social circles tend to reduce as you age and your life gets busy and you've got kids. Men do really badly. Really, really badly with this, because women, we have a bad day. Our husband hasn't taken the bin out. He's not put his socks in the laundry basket. You're angry at life. You pick up the phone and you tell your friend, I'm really angry today. I'm really struggling today. And you vent it out. And that's a really healthy process to vent it out. Men don't do that. Men mask problems. So they kind of isolate themselves. They pretend everything's okay. They mask. They don't tell anyone they've got financial problems or they've got low libido or whatever else they're going through. And therefore, particularly when they start to hit 40 and above, when their testosterone starts to reduce, they start to also go through andropause, which is a hormonal change that men go through, but they don't talk to anyone about it. And so they suffer with depression, anxiety, and they're much more likely to become suicidal. So we lose a lot of men through suicide around the age of 45 to 55. So I think social connectedness is a huge protective factor for health span, and for lifespan. Huge one. And I wish people knew that more, is the value of friendship. And you don't need to have lots of friends, do you? It can be one or two, but just seeing people more, there's a huge amount of power in that. So thank you for seeing me and chatting to me all the time.
Thank you.
And so the last one is harmful substances. We've covered nutrition, we've covered stress, we've covered exercise, we've covered the importance of sleep and social connectedness, and reducing toxic loading or harmful substances has a huge impact on health and well-being. And that can be through a whole range of different things. Talk to me about what that looks like.
So I think when we talk about harmful substances, the obvious ones that would spring to people's minds would be not smoking. Yeah. We know that's very damaging to our physical health, but relating it to aesthetics specifically, not good for your skin at all. It's very inflammatory and increases the aging process as well.
And inflammation is a precursor for all disease, right?
Exactly.
So smoking increases inflammation, but also the nicotine in it, that's pretty bad for us because it's a vasoconstrictor. So if you have a vasoconstrictor running through your body, that means that it's reducing blood flow. And if you have a reduced blood flow to whatever area of your body, then you have reduced wound healing, you have less oxygenated blood. And you, again, this goes right down to oral health. And I'm a bit obsessed with oral health because there's so much evidence now about the fact that gut microbiome starts in the mouth, the oral microbiome. We know that the gut microbiome impacts skin microbiome, so it's all connected. But when you're smoking and because you've got this vasoconstriction, your gums don't bleed. And gingivitis, which is gum disease, one of the first signs of inflammation of the gums is bleeding. And a lot of people think, when I brush my teeth, it bleeds, but that's normal because I'm brushing. And no, it's not normal. That's a sign of gum disease. And it's something not to ignore because gum disease predisposes to poor oral health, bad breath, poor gut microbiome, poor skin health, reduced wound healing, but also Alzheimer's and dementia. Also cardiovascular disease. You're much more likely to develop cardiovascular disease if you've got gum disease. You're much more likely to develop dementia. But if you're smoking and it masks that sign, then you won't know. So it masks underlying disease, and that's the danger zone, I think, with smoking in particular, and all these chemicals that they kind of almost, when people take drugs, it masks things, it masks emotions, it masks our actual health or ill health. So I interrupted you there. Sorry, go ahead.
No, just to add to what you're saying there, when we talk about smoking, I think, we're living in a world now where most people have moved on to vaping, certainly in my friendship circle. And
what do you think of that? Is that good, bad?
It raises significant concern for me. I've had a look at the data, and whilst it would suggest that it's less harmful than smoking, and can definitely be beneficial to people who are trying to get off smoking when they are addicted and they've been smoking for a long time. It still has many harmful effects. It does affect the microbiome within your mouth, like you mentioned. And it actually fits into what we're talking about, harmful substances. Vaping, the chemicals within vapes is a huge number of different chemicals, which essentially majority of them haven't been studied long term.
Scary.
So whilst we don't have the evidence yet to show that they are damaging, I am concerned that in the next 10 years we will see rising evidence to show that many of them are very, very harmful. So my personal opinion would be to try and avoid vaping.
Okay, nice. And any other harmful substances that people should be avoiding?
Well, I think when we're talking about aesthetics, one we spoke of recently was sunscreens, chemical sunscreens and mineral. Perhaps you could explain your opinion on that.
Yeah, I think I'm going to be shut down about this because it's quite controversial. And I hear that it's controversial, but it's something that I'm quite strong on. I, generally speaking, will always recommend mineral SPFs to my patients. There was a huge study done at just the beginning of lockdown, February 2020, that was released that looked at 20 SPFs sold in the market in the UK. And they found that 19 out of 20 of those had a higher chemical load that was toxic and actually found in the bloodstream. So when they did a blood test, they found that that chemical was found in the bloodstream, higher than is allowed. And so kind of went against the regulations. And that's the problem is people think that what they put on their skin just stays on the outside. But actually our skin is not just a barrier. It's not just there to keep the good stuff in and the bad stuff out. Is that right? Yeah. It's actually a carrier. So you absorb your makeup, you absorb everything you put on your skin. So you have to be really, really, really mindful of that and start to get really selective about what you're putting on your skin. Now, this whole concept of clean makeup or clean skincare, I think that's a whole marketing ploy, or chemical free, because everything's a chemical. There's, water is H2O, it's a chemical. But it's about knowing what those chemicals are and avoiding the ones that are not good for you. So when it comes to sunscreens in particular, and you and I are evidence-based, we are medical practitioners, we are science-based. What we know from the science is that mineral SPFs like zinc oxide, titanium dioxide, these two minerals, zinc has actually been found to be very healing for skin that is inflamed, skin that is eczema-prone, cancer-prone, acne-prone. And FDA conducted a study that said that these two chemicals, or these two minerals rather, are safe. They're the only safe SPF components. And the other ones like avobenzone and homosalate, oxysalate are actually endocrine disruptors. So they're absorbed into your body and they negatively impact your hormonal balance. So you can get away with a heck of a lot up until you're 35. People go around partying when they're 20, drinking lots of alcohol, smoking, whatever. Your body is a little bit more resilient. But as you grow up, as you're aging, and over the age of 25, your hormones start changing as early as the age of 25. By the time you're 35, we know that you've lost so much collagen, 1.5% a year. Your body is changing, and it starts to change very rapidly when you hit 40 and above, at which point you are losing 30% of your collagen. So I want all of my patients to wear SPF. SPF is a very important protective thing that they can do, preventative for skin aging. We know that 90% of premature aging comes from the sun. They need to wear SPF, but be mindful of what SPF you're putting on your face. Try and avoid these specific chemicals, homosalate, oxysalate, avobenzone, because they are endocrine disruptors. They can impair the hormonal balance. And I am much happier when my patients, I'm much more comfortable recommending to my patients mineral SPF. So one of my favorite brands is Color Science. That's what I use on myself, on all of my patients. I will only ever recommend mineral SPFs. I think there's a lot that you can do on a daily basis to reduce chemical loading, and start with skincare. Be really, really specific. If you don't know, reach out, ask us. We are here. We are experts. We read up. We're a scientifically based. This is not opinion. It's not feeling. It is fact. And until the science says otherwise, I am a big believer that we are duty bound to help our patients to avoid harmful substances. And that means reducing chemical loading even in skincare. So for me, chemical SPFs is one of those that you won't see me recommend. Now, I have to caveat that any SPF is better than no SPF. So if you can't handle or you can't afford a mineral SPF because they can be a little bit dearer, then fine, wear the SPF. The best SPF is the one that you're going to wear. So wear it, because we know that cellular aging, skin aging is massively exacerbated by sun exposure. And so too is the risk of developing skin cancer. So any SPF is better than no SPF, but if you can afford it and it's not that much more expensive, definitely go for a mineral SPF and avoid harmful chemicals in your skincare as much as possible. And reach out and, speak to an expert who knows your stuff and can advise you. That would be my advice. That would be my big take-home message to my patients. And I know that the pharma industry will shoot me down for that, but chemicals are cheap to create, right? Like that's why they're in Boots and everywhere. But it's not what I would recommend to my patients.
I completely agree. I think when we start looking into the world of harmful chemicals, particularly in the beauty industry, it can become quite overwhelming, and you start realizing they're everywhere. I think a sort of takeaway message I would say to that is just for people just to start looking at the things that you use daily and where you can make a difference. So like you said, the product that you're putting on your face every day, the SPF, and trying to ensure that you know the chemical ingredients of that product and that the majority of them are deemed as safe and not harmful, because that's going to have the biggest long-term impact.
Yeah. Last thing we want to do is confuse and lose people. But essentially, huge amount of advice on this. Lifestyle medicine, lifestyle treatments are huge. They have the impact to heal the body. There are treatments that you can tap into that can improve wellness, reduce body inflammation, enhance your overall health span, not just your lifespan. So we've covered quite a lot. We've covered the 6 pillars of lifestyle medicine. Thank you so much, Dr. Kate, for joining me. For anyone who wants to find her, you can book in with Dr. Kate either in London or in Liverpool. Until next time.
Thank you so much for having me. It's been a pleasure. And thank you for helping me manifest my dream to be on a podcast.
Oh, amazing. Thank you.